Folks are still arriving, but I think we'll get going in the interest of being respectful of everyone's time. Good afternoon, everyone. My name is Nancy Fishman, and welcome to the Vera Institute's webinar on COVID-19 and jail releases, collaborating to keep communities safe and healthy. We know right now, in the midst of this pandemic, that folks inside government and in communities impacted by incarceration are trying to figure out how to help, how to save lives, how to make good decisions under unprecedented circumstances. And we're all doing this while dealing with the stress and anxiety of worrying about our loved ones, our communities, and uncertainty about what the future holds. So we thank you for all that you're doing, and thanks for joining us today. Today's webinar will focus on how jails are releasing people in response to COVID-19. Our goal is to provide concrete examples of how a number of jurisdictions are working to get people out of local facilities and help them remain safe and healthy in their communities. We know that jails are among the worst places for people to be during this pandemic, with little ability to maintain proper hygiene, keep safely distant, and receive testing or adequate medical care. Once the virus enters a facility, it can spread fast to both people who are incarcerated and people who work there. Jail incarceration also places at greater risk the families and communities of people who are returning home. So this is a critically important topic right now. No one has it perfectly figured out, needless to say, but we all need to be moving forward right now and hopefully set the stage for what can happen next that might be better. Before we begin, some housekeeping. All attendees are on mute and will remain on mute. If you have any questions during the webinar, please type them into the chat box function. You'll see it at the bottom of your screen and it should pop up, and we'll aim to address the questions at the end during the Q&A. If you don't want to share with everyone, we ask that you direct them in the chat function to Amy Cross, who'll be moderating that section, or just send to the kind of co-hosts or panelists in the chat. You can also send any technical issues that you may be having, and we'll do our best to help. I'm not sure how much we can do, but we'll try. So I'm going to start by introducing our panelists and then hand over to my colleague Liz Swoboda, who will be facilitating. So first we have Tiffany Iheanacho, who's the Justice Resource Coordinator in Buncombe County, North Carolina. In this position, Tiffany leads the county's efforts in criminal justice reform and works collaboratively with county and criminal justice leaders to enhance the efficiency and effectiveness of the county system. We have Laudermilk, who's Deputy of Policy and Strategic Planning at the Law Office of Cook County Public Defender. She's also an adjunct professor at the DePaul University School of Law. Claire Starling is an Assistant District Attorney with the Milwaukee County District Attorney's Office. She has been with the DA's office for 16 years and is currently assigned to the Early Intervention Unit funded through the MacArthur Foundation Safety and Justice Challenge, where she focuses on mental health diversion. And Patrick Sullivan is a site launch coordinator and site manager at the Bail Project. In 2016, he co-founded the Connecticut Bail Fund, the first of its kind in Connecticut. So with that, I will hand over to Liz Swoboda. Liz?
Thanks, Nancy, and thanks to our audience for joining us today and to our esteemed panelists for this very important conversation. So we want to start this discussion with logistics, how the counties where you all work are going about releasing people from jail during this pandemic. So I'll start by asking what mechanisms are being used to release people or avoid booking them in the first place, and how is eligibility determined? And Claire, we'll start with you.
As far as people entering the jails now, our police are only putting people in custody if it's a domestic violence offense, an OWI, or a felony offense. So all of our offenses right now are being booked in the district stations and being released. As for how we are dealing with people who are already in the jail and releasing them, pretty early on, our county put together some subcommittees, and on the committees there's a judge, a DA, and a public defender. And we're really going through subpopulations of people in our jails and trying to find people that we can release. Some of the examples of subpopulations are people who are on low cash bail, people who are mentally ill. That's my committee that I'm on. We have a subcommittee for women, and we have a subcommittee for people that we think may be appropriate for GPS monitoring. So that's really how we got together to try to reduce the population of people who are already in custody.
Great. Era or Tiffany, do you want to jump in?
Sure. So our strategy in Cook County has evolved over time. So this all really started for us during the week of March 9th, when the COVID virus was really beginning to take a hold in the United States, and we were trying to figure out like what impact this was going to have on our clients who are in the jail. So thankfully, we had a good partner in our local sheriff who sent us lists of different subsets of populations who were in the jail. I remember that weekend, a few of us spent the entire weekend going through those lists, looking at individuals who we thought would be the most appropriate, and also who would be the lower hanging fruit that we wanted to just get out of the jail as soon as possible. So those include people with lower bail amounts, so $1,000 or less to walk, our misdemeanor clients, our pregnant clients, clients that were over the age of 60, clients who the sheriff had indicated had some underlying medical condition that put them at more risk of the dangers of COVID-19. We reviewed all of these lists. We flagged clients who we thought should be appropriate for immediate release, and we sent those to the state's attorney's office. They in turn did their own review. And it takes a lot of time to go through these cases, right? Like it took a lot of time for us to go through them, but then the state's attorney, they have access to the entire criminal record history of these individuals. And what we found was, even though everyone understood the importance of getting folks out of the jail, we had very different philosophies of what that looked like. So we felt that certain categories of people, there should just be a mass release, because in our opinion, this was an emergency. The state's attorney had a different opinion. They agreed that this is an important issue, and they put a lot of manpower and a lot of hours to reviewing criminal history cases, but they did not agree with a mass release approach. Ultimately, after like 8 to 10 days of going back and forth, reviewing lists with the state's attorney's offices, we were able to come up with about 100 people that we all agreed should be released from the jail. We were able to do that. But we were getting frustrated because it was, in our opinion, taking way too long to get people out of the jail. And so we started thinking about like, what's next? What can we do to help increase the speed of getting folks out? So we ended up filing an emergency petition for the immediate release of persons detained in the county jail who do not need to be confined there. And we filed this emergency petition on a Friday. On Monday, March 23rd, we had a hearing. The presiding judge at our largest criminal court building agreed with us and said, we agree that these categories of people are the appropriate population that should be reviewed in terms of immediate release, but we don't want to do a mass release. So we were given a period of 4 days, so from March 24th through March 27th, where the court said, public defenders, motion up as many of these people who fall into these categories as you can, so we can do some expedited bond review hearings. We're going to do them on an individual basis. We were able to get the state to agree to several of them, but for the most part, everyone had to have a hearing. So we did that for those 4 days, and we've continued to do that ever since then in all of our court locations. We feel that that's been relatively successful. We've been able to get approximately just over 1,100 people released from the jail through those expedited bond review hearings, but it's still not enough. And so that's where partners like the Bail Project has really stepped in, because for those cases where we had the hearings and the judges ruled not to release those individuals, we've been able to send those cases to the Bail Project for them to consider posting the bonds so these people can get out and go home to their families. So that process continues until this day. We continue to work every day just to advocate for our clients in court to get as many of them out of the jail safely as we can.
Great, thank you. Tiffany?
Sure. Good afternoon, everyone. So, some framing. Buncombe County, Asheville is the county seat for Buncombe County. Our detention facility is about 604 at capacity. We were hovering around 529 before COVID-19, and we're currently at 346. So we've reduced our jail by approximately 40%. There was a lot of groundwork happening anyway. Some of the implementation strategies through our Safety and Justice Challenge, we had a long list of ideas that we wanted to accomplish and strategies that we wanted to implement. And prior to the week, or the week of March 16th, the week prior, a lot of articles were circulating about jails and COVID-19 and conjugate living facilities and the high-risk population. And so over that weekend, I think a lot of stakeholders were calling and engaging in meaningful conversation about what can we do right now to ensure that we don't have an outbreak in our detention facility and that there's no deaths that occur in the jail. And so they worked together and we started getting phone calls on Monday with the plan. And for me, it was so much going on. I had to frame it in a way that was meaningful. And so if we look at the different intercepts, I think each of our stakeholders and their staff took leaderships and efforts to ensure that we can reduce the jail. Law enforcement was encouraged to use more citations and less custodial arrests and have been doing so. Our defense attorneys started staffing at first appearance and working with the defense, with the prosecutor and the judge, reviewing bonds and seeing possibility if cases could be resolved at that intervention. The district attorney started scheduling time specific in Superior Court. And I'm sorry, back up. North Carolina is a unified court system. And so our Chief Justice Beasley extended majority of the court matters until June 1st, except those that are procedural and constitutional. So it actually gave us great time to look at our jail population. And so there was a couple of split sentences that the DA's office agreed to postpone. The courts worked with the magistrates to unsecure bonds for misdemeanors and low-level felonies, except the DWI and the domestic violence related cases. I'm continuously doing bond hearings to review bonds. Our Superior Court judge, our resident Superior Court judge, and our Chief District Court judge filed the administrative order to postpone the weekend sentences, so they will not have to do their sentences currently. And then as we started looking at our the lower level felonies and unsecuring the misdemeanors out of custody, kind of realizing like what our next steps could be at those medium to high risk offenders. And so working with pretrial services to determine what EM capacity could be. We currently are using only 15 units. And so what would that look like to double some of the EM availability with staff? And pretrial services continues to do risk assessments remotely and able to provide those to the courts. And the clerk's office moved very swiftly to send out notifications for the extended court dates and promoting our state's court notification system. So that's just a blend of some things that all of our stakeholders pulled together to get done. And I would say it's been a month and we've reduced our jail by 40%. So some significant work happened.
Great, thank you. And Patrick, I'd love for you to jump in and first just briefly describe what the Bail Project is and what it does, and then what you're seeing on the ground in terms of how people are being released around the country.
Yeah, thank you, Liz. So the Bail Project is a nonprofit organization that posts money bail for people who can't afford it. And then we work with those folks to provide them the support that they need throughout the duration of their case. And so, we're often acting as a bridge, in non-COVID time between people who are coming out and then ultimately sort of a more sustainable, we're trying to hold people as they come out and take care of them. And so we've been, super grateful to work with ERA and the Cook County Public Defenders for a while now. But I think the COVID-19 time has kind of heightened everybody's awareness of what does it mean when people are coming out and how can we wrap around support for them. And so we've been really grateful to work with system stakeholders to try to brainstorm creative ways that we can do that for a lot of people at one time, because easy to do for 1 or 2 people, but when you're talking about, 20, 30, up to 100 or 200 people, it becomes much more challenging. And so I think that's been one of the big challenges for us in this time, is how do you do this on a really large scale? But it's possible, and I think Cook County is an example of that, where they've been releasing folks for a while now. We've posted bail there for over 200 people in the past, I think, a little over a week. And the kind of process there is working to get some minimal information on the front end so that we can make sure that that person has a place to go to, that they have, some place where they can land when they do get out, and that place is going to be safe for them, and also that those people are prepared knowing that this person may have been exposed inside of the facility. And so we do a little bit of front end work, and then once people are out, we reconnect with them in the day or day after they get out to try to understand what are those other needs that they have. Do they need food? Do they need transportation to medical appointments in some way? Do they need a separate housing location because the one that they're in is just not going to work out for a significant amount of time? Better if we can figure that out before posting bail for them, but sometimes you gotta react as you're getting folks out. So that's kind of generally what we do. And we can speak in Spokane specifically, which is a site that I've managed for a long time. In Spokane, Washington, we were able to work with, they have 3 different courts. And so before we even posted any bail, we offered to the system stakeholders, listen, if you give us some minimal information about folks, we can do this needs assessment on the front end, really kind of try to get a picture of how to support folks. And if you can release them, we promise we'll show up, we'll support them in the typical way that we would for all of our clients, with rides to court, rides to medical appointments, connection to healthcare providers and other social services. And so we offered that at the front end, and that, I think, coupled with the jurisdiction's interest in getting people out, really inspired folks to release a significant number of people right away, and brought the jail population from a little over 900 down to about 680 right now.
Great, thank you. So that is actually a really good segue into my next question, and anyone feel free to jump in on this. There's been this great effort to get people out of jail and quickly. I'm curious what's happening in your jurisdiction once people are released. So if there are, for example, partnerships between the legal system and whether it's healthcare or housing, to be able to support people in their reentry, and how you're assessing needs before releasing folks.
Yeah, sure. I'll jump in since Patrick mentioned a little bit of what's happening in Cook County. Some of you might know that Cook County has been deemed as one of the largest, if not the largest, cluster of COVID-19 cases in the country. As you can imagine, with that comes a lot of fear from the general public about how these releases are taking place. And I mentioned that we filed a massive petition seeking the release of individuals. We knew we had to do this in a very smart, strategic, and safe way. So in anticipation of that, we worked with several partners, including the jail, including a local provider called TASK, the Bail Project, other county service providers, our Cook County Health System, to develop a new discharge plan for people coming out of the jail to make sure that we're doing it safely. So everyone in the jail, when they're coming out, they are getting screened. They're going through a health screening. Individuals in the general pop are being screened through temperature taking and another screening approved by the CDC to determine whether or not there are any COVID risks. And if so, they're directly referred to our Cook County Health System. Individuals who are in the jail who have tested positive or who have been exposed, they are also going through screening, but it's a little more rigorous, and it's conducted by our Cook County medical professionals. The jail is calling home. So when people are being released, before they leave the jail is calling the home of every single detainee to ask questions about whether or not COVID-19 has impacted that household. And what we found is a lot of individuals, family members, have concerns about their loved one coming from this particular jail into their home. So we knew we needed to really look at our resources and make sure that we had adequate beds. So if for whatever reason, someone is either homeless or they can't go home, we've identified beds in the community that they can go to that we know they'll be able to do that in a safe way. We also have providers that are doing screenings for mental health, substance use, food insecurities. There's telehealth providers that are available in the community. So we're really trying to wrap services around these individuals to make sure that we're supporting them as much as possible to make sure their transition from the jail home and into their communities is as safe and effective as possible. We've relied a lot on partnerships. We make sure that we're in communication with the city of Chicago because the overwhelming majority of the people that are leaving the jail are being released to the city of Chicago. And they also have dedicated several resources to help fill in any gaps in terms of need that we might identify for individuals that are coming home from the jail. So we really tried to make it in a relatively short amount of time, right? All this kind of sprung up on us, but we've really tried to be as collaborative and as thorough as possible in order to do this in as safe of a manner as possible.
Great, thank you. Claire or Tiffany, do you want to weigh in?
Sure. Claire, do you want to go? I think echoing some of what Eric said is some of the similar things that we practice here. Buncombe County had a Justice Resource Center that's adjacent or next to the jail, and the case managers in the jail are well connected or are part of the same team as the Justice Resource Center. We just had to get creative about reentry efforts to limit people going into the jail, not having case managers there, just detention officers. And some of the things that the jail's done too, similar to Cook County, is in order to adhere to CDC guidelines, anybody being booked in the jail being quarantined or in a single cell housing unit, and classifications for that 14-day window to ensure COVID was not entering the jail, or try to minimize the impact and have detention officers screened and doing the screening checks. And so one thing about getting creative is understanding what resources are out there and making sure that we're abreast of any changes. So our Justice Resource Team is connected to our Emergency Operating Command and our behavioral health strategies. So they have pathways to get people connected to the food resources that have been made available, to the behavioral health services that had to be modified, more virtual connections. Many of our recovery meetings have went virtual, and so making sure they have access to that. One of the barriers we've seen is the unfamiliarity with how to use technology and doing virtual screenings. And so getting a community comfortable and engaged and informed about how to use those services, and letting them know that telephone services is also available. The county last week opened a homeless shelter in our civic centers, many across the country have done. And so making sure that we have referral pathways for individuals that do not have COVID or the symptoms or need to be isolated and quarantined to be able to be sheltered during this time. It's also a beautiful time in Asheville, so just making sure people feel safe wherever they are and not exposed, even if they decide to use camping grounds or some type of unsheltered facility.
We have a lot of the same practices of North Carolina and Cook County. I would just note that we do not have good weather right now. It's been snowing here. There are 2 emergency shelters, temporary shelters that have opened up, one specifically for people who are testing positive, and one for people who are not. So that's helpful. Other than that, I would just echo all the different efforts that are going on in the jails that the other attorneys spoke about.
One thing that I would like to add, that in case other jurisdictions are looking at creative ways of thinking about releasing people safely, Cook County and the city of Chicago have basically rented out hotels, and they've put individuals in hotel, both the homeless population as well as individuals who need to quarantine related to the COVID-19 pandemic. And we found that you know, that's been a really huge resource for us, and it's beneficial to the hotel industry, but also it's really helped us when we're trying to figure out placement, and doing so under the confines of the social distancing requirement. So hotel rooms throughout the county has really helped us be able to place people in a really safe way.
Yeah, are your hotels being very particular about who they let in? Ours are.
No.
Ours were running background checks and doing a lot of things like that.
Interesting. Okay, so to kind of, oh, go ahead, Tiffany.
I was gonna say for us, we've seen some of that. It's been about 50-50 and just working with different hotels and trying to partner and get creative.
Yeah, I think the hotels that I'm aware of are probably smaller, like mom and pop shops, so they probably don't have as much corporate red tape that they have to overcome as some of our local hotels that are in the communities where a lot of these folks are going home to anyway.
Great, thank you. So next, I'm curious about how counties are communicating with the public about new policies and practices that are being put in place. I mean, Era, you touched on it before. There's a lot of kind of fear in the community about what's happening. So I would like to hear from all of you about how government partners are keeping the public updated, and whether they're sharing data, and if they're not doing that, what you all collectively would recommend.
Our Milwaukee County Justice Council is still meeting. So that is how we communicate with the partners around our jurisdiction primarily. Our leaders have been accessible to the media. That's another thing. We feel that results in better communication and better produced stories regarding what we're doing in this community.
So we've had a lot of media attention here. It's not the kind of media attention that you want to be known for, as being one of the largest, if not the largest cluster of COVID-19 cases in your jail. So there's communication with the media pretty much daily. From a public defender perspective, our public defender, Amy Campanelli, has been on national media outlets, local media outlets, and really just trying to paint a picture of what we're dealing with, right? A lot of people don't understand that we're talking about a jail population where the majority of the people are there because they can't afford their bail amount. So they're sitting in jail waiting for their trial, that they are or have been considered bailable by the court, right? So they're there because they're poor. That's the only reason they're there. They didn't have $500, $100, $1,000 to pay their way home, and really just trying to humanize the individuals that we're talking about, and recognizing this is a public health issue, right? If our jail is in a dire strait, then all of us are in a dire strait, and we need to do as much as we can do to be as proactive as we can to try and unring this crisis of a bell that we've rung. So we're trying to just provide information around the numbers. There's been a lot of media attention around these expedited bond hearings that we're doing. So the media really wants to know like how many people are we presenting for consideration? How many people is the state's attorney agreeing to? If there is an agreement, are the judges following through with letting these people out? If they are being let out, where are they going? Like we've had some tough conversations with the city of Chicago, mostly around policing, right? Like the Chicago Police Department really has wanted information around where these people are going, where they live, who they are. And, you know, we've had some tough conversations around, from our perspective, that's not what the priority should be right now, because we don't want any more fear among communities, among our clients, you know, who are just trying to go home and quarantine like everyone else and be safe. So, you know, there's been some difficult conversations because everyone wants to do this in a safe way, and we're still trying to massage some differences around what that should look like. So just from our perspective, painting a clear picture of who we're talking about and why, right? Like we're not asking for people who we think would be a danger to the community to be released. We would never ask for that. What we're saying is there are people who we've identified who we believe shouldn't have been in the jail in the first place, and we believe that they should be allowed to go home in light of the COVID-19 pandemic, so that the individuals who have to stay in the jail can stay there in as safe a way as possible, and so that the jail can have the capacity to enable social distancing for those individuals.
So I would echo the last part Iris said too, definitely is where our framing was. But I mentioned earlier about the emails that was going around about conjugate living and high-risk individuals. And to that end, our advocacy groups and our community engagement participants was posting the same information on Facebook and tagging the sheriff and the DA's office to work with the courts to release low-level individuals. And so it was really a community effort, and a part of the collaboration, we do have an advisory council where our stakeholders work together, and the county chairs that commission or advisory council. And so the justice partners have been invited in to participate in the press conference, the daily updates that were occurring to give the community updates about the court systems. I know that our judicial officials and court partners have been posting updates to their Facebook page as well, including the sheriff's office posting information. What we've also seen, and I don't know about other jurisdictions, possibly the uptick in domestic violence calls for service and bookings into the jail. And so the sheriff put out a press conference letting community know that domestic violence will not be tolerated, and for survivors and victims, there are still services and supports available for those who need it. And so making sure that we're outreaching. I think it's more important for us to be a little bit more intentional, but we have a lot of work still to do. And so making sure that we are very intentional about the language that's communicated to community, and it's in a plain language approach where we can understand and have shared dialogue.
Our community also has daily press conferences with leaders and health experts every day at 3:30. That's been helpful. And then there's a COVID link on our county website as well that people have been accessing.
I just want to chime in quickly, and it's less related to kind of stakeholder communication, although it sounds like y'all have come up with some really incredible strategies for that. You know, one of the things that right away our teams were trying to figure out is, okay, you know, what is available still in terms of resources? And so each of our teams developed, you know, kind of running lists and spreadsheets of what is available that we update as, you know, as quickly as we can. And there's been an amazing growth in the kind of mutual aid networks that we see across this country, and they have existed long before this time, and I certainly hope will exist even maybe in more power after this time. But we've been very careful about, you know, every single time we communicate with a client, mentioning that they have these potential resources that they could go to, you know, specifically for their needs, but also just generally, because we know that our clients are also a powerful source of information for other people in similar situations. And so if we're able to bail one person out of jail and kind of give them the tools that they might need, they will talk to their friends and kind of have that community spread around. And so we've seen wonderful networks of our clients gathering together and figuring out how do we get through this together. And so I think there's an especial power in having community groups give out resources and make sure that that information gets carried from, you know, those websites that they might be able to look at it on, that information really gets carried to the people who need to hear it the most. And so again, involving community organizations in that strategy, I think has been particularly helpful in some of the jurisdictions where we work. So St. Louis is an example, and working very closely with the continuum of care folks who, you know, and all of the kind of resources providers in that jurisdiction to say, okay, we have 3,000 clients that we've posted bail for. We can get information to people in these communities and really get it out quickly. And so we've used our automated text systems and other communication devices that we have that we typically use for court reminders to very quickly get out information about resources and other types of valuable things that people could use in this time.
Great. Thank you, Patrick. I appreciate you bringing the community into the conversation. So before we turn it over to the audience for questions, I want to hear from you all about lessons that you're learning. I know we're all moving quickly and adapting to this new reality. Hopefully at some point we will return to more normal times. So are there lessons that you are learning that could be carried over into the future?
I think that's one of the things that we're asking ourselves, how to sustain these efforts, keeping in mind public safety, and when normal court operations return, so balancing court matters in a way that is efficient and effective. So I think we'll probably be more intentional as we get further along in discussing how do we sustain these efforts. Data has been a very useful tool. Our sheriff's office does have a public-facing dashboard that tracks jail data. It's been in place for almost a year now. And so community can start seeing trends actually occurring. And I think one thing that we realized, jail reduction was our strategy. It's been our strategy. We didn't have any momentum, and we were having this snowball that we're trying to get downhill, but we're all pushing in different directions. And so COVID-19 kind of gave us just this momentum and energy to start pushing in the same direction and working better together and more collaboratively. And so I think lessons learned, one thing, and I think it's something that is important, is just to keep monitoring to the data, especially in terms of disproportionality of people of color. I think we had disproportionality to begin with, and our data experts and staff who watch it kind of understood why, related to the average length of stay for certain offenses for people of color. And when you start removing those low-level offenses, you can start seeing where the data starts speaking louder, and at some point you have to discuss it because you see it going up. And so a lot of questions were raised, and that's just driving us to be more intentional about addressing our racial disparities and looking at kind of the root causes and working collaboratively to address those root causes.
And honestly, you know, we all strive for jail population reduction, and we're getting it. And if it works, if people aren't, you know, reoffending as soon as they get released, and if people who are being booked and released aren't, you know, causing havoc in the community, I think it's such a good argument is going to be able to be made that we should continue this trend. So I think it's going to be helpful in the future, hopefully, for the reduction. In Milwaukee, I would say one thing that's been super interesting is the technology we've been using. We did not have any of this technology before to work from home, to do hearings remotely. And so that's one thing I think we've also learned from this, that it's possible to be able to do more advanced technology work in the future too.
I would echo what's been said. I would hope that, so we also we had a jail reduction strategy through the MacArthur Safety and Justice Challenge, and we had been pretty successful on that. But I think because of the success that we had experienced, there was some complacency that had settled in terms of where our current jail population was. So when this all started, we were at just over 56.
That's okay.
I was saying that there had been some complacency around our jail reduction, which, you know, I was just worried about our ability to continue on the trend of doing our jail reduction. So I have on March 16th, we had just over 5,600 people in our jail, and today we have just over 4,200 people in our jail. And I'm hoping that when we come out of this, that we can maintain this level and then continue a reduction from this level, and not just open the floodgates of the jail back up and have all of these people who probably shouldn't have been there in the first place go back to the jail. Also, in terms of policing strategies, our Chicago police officers have been issuing more citations in lieu of arrests to try to help ease the flow of individuals who are going into the jail. The world hasn't ended, right? Like, I'm hoping that this can start a new trend of some of the policing practices. We also have a brand new police superintendent who came on board in the middle of all this. I'm hopeful that some of these newer policing strategies around not arresting some of the nonviolent individuals who aren't posing a risk to the community. Hopefully they'll continue their citation practice, but I think we're still trying to identify the lessons learned too. The data is going to be a critical piece. I think everybody's trying to see, like, what does the data tell us and what can we learn from the data in terms of, tweaking our jail rejection strategies moving forward. I love that everyone is coming together around a public health approach to who's in our jail and a public health approach to releasing people from our jail. And I hope that will continue as well.
Mm-hmm. Great, thank you. Patrick, want to give you a chance to weigh in too. And also if Tiffany kind of opened the conversation about racial and ethnic disparities, would also love your thoughts on, as jail reductions are increasing, how we can ensure that disparities don't deepen.
Yeah, I want to talk, I think first just, I think, we talk all the time about how, money bail is, a two-tiered system of justice. I think in this pandemic, we see that even more. And so we are really thrilled to be able to work with system stakeholders and get people out of jail. And our hope is that doesn't mean that, money bail is going to be then needed in the future, right? Like, we're paying these to get people out of jail because these are the current systems that we have to operate with. But in our ideal world, I would much rather meet someone out having never had to pay money bail in the first place. I'm happy to provide the support and wrap around the person with all that they might need, work with community organizations to do that, but we shouldn't have to pay money in the first place. And I think if that wasn't clear before this, it is very, very clear now. And I would just add one little piece, which is not typically what the Bail Project talks about, but I do think it's important in this time to think about, also what is happening with, parole and probation.
Oh, Patrick, I think you're on mute.
I think he's, oh, there he is.
My video got cut off. No apologies.
No worries.
But I was just making a small point about parole violations and probation violations. That's been a particular challenge for folks in many of our jurisdictions being released. So we're able to get all the people out who had bail set, but then there's a bunch of people who are in on violations. And so I think a really creative conversation about how could we be handling that better, some of the kind of compliance around, post-sentence or after a case is done. What can we do more creatively to make sure that those folks aren't going back in and out of our jails as well? And then there's, of course, a question about sentencing, which I don't want to talk about because it's not my lane, but there's definitely a lot of people who are in prisons across this country as well who don't need to be there also. And they're particularly vulnerable, oftentimes very elderly folks who've been in there for a long time. And so I think it's exciting to see that conversation starting as well. And it's been happening a long time, but I think that's an important piece, maybe not for me to talk about, but that's important to keep that in this conversation as well.
Great, thank you. Did anyone else want to address the question of racial equity and how I know it's a big question for a few minutes, but any thoughts on,
I think a lot of things are coming to light. I mean, things that I think all of us who work in the system have been aware of since we've started this work, but I think the general public some light is being shed on the racial disparities in terms of who's in our jail. And we're even seeing some of that play out in the media, right? Like, Black men now have a fear of walking around in masks. A lot of governors have mandated that people wear masks in public. From a health perspective, that people are afraid. And I even had an officer say recently, oh, now they're all allowed to wear masks, so now they could just rob anybody in broad daylight, and how are we going to control that? So there's this perception of Black men in general as being dangerous and being violent, regardless of whether or not they are. There's the example of the doctor who was arrested in front of his house while he was loading a van on his way to provide tents and COVID testing for the homeless population in his community, but they are being perceived as dangerous. And I worry about that. I worry that those stereotypes will continue to result in the unnecessary arrests of Black men and the unnecessary admission into our jails simply because of this perception of fear that people have that they pose, regardless of whether it's valid or not.
Thank you, Era. It's a really powerful note to end on. I want to just thank all of you for answering my questions. And now I will turn it over to my colleague, Amy Cross, to ask questions from the audience.
Muted. Hi, everyone. I'm Amy, and we got some excellent questions from the audience touching on a range of topics, reentry, racial disparities, a lot of questions about advocacy and sustainability, and then some technical questions about things that are actually happening on the ground right now. So just to start with a kind of quick and easy question that was directed towards the Bail Project, I hope it's an easy answer, but Patrick, are there ways for jurisdictions that don't have a Bail Project to avail themselves of resources?
Yeah, that's a great question. I would, there is the Bail Project, and there are also hundreds of community bail funds across the country as well that are doing really tremendous work, have been doing this work for an incredibly long time. And since bail existed, there have been communities posting bail. And so I would point you to the National Bail Fund Network and the National Bailout as two other organizations that you can go to and see if there may be a bail fund in your community. The National Bail Fund Network has an amazing list of all of the community bail funds across the country, both for criminal kind of side of things and immigration as well. So if your loved one is in immigration detention, you can find resources for them there. And so I would say if Bail Project is not in your particular location, there may be a bail fund there that could support. And that would be kind of the place that I would direct you.
Wonderful, thank you. Regarding some other actions being taken on the ground as far as managing some of the conditions that people in jail and also people who have warrants are facing, can maybe Era, you can speak to this, or actually any of you in practice, but I'll kind of clump these questions together. Somebody asked about how probation violations and technical violations have been handled on a policy level. Have there been changes there? And also how are treatment courts handling this? Are judges still issuing warrants for non-compliance with treatment or for having contact with probation? And additionally, for folks who have warrants in the community who may have tested positive for COVID, for example, but want to turn themselves in, have those kind of situations arisen, and how have they been managed? If you'd like to speak to any of those.
Sure. So in general, in Cook County, our chief judge has issued a few administrative orders. Our court system, for the most part, has come to a grinding halt with the exception of emergency matters, some preliminary hearings, bond courts, and the judges have been instructed not to issue those warrants. I think our probation department has, in general, over the last year or so, has really made a concerted effort to implement more graduated sanctions for individuals who are on probation, and their probation officers, both the adult and the juveniles, have been given directives on being a little more generous and a little more hands-off. I think everyone recognizes, like, this is a pandemic, right? Like, there needs to be a level of grace that everyone needs to extend in light of the fact that this is literally a matter of life and death. And the answer right now is not putting people in the jail. Our jail admissions have reduced significantly. We probably have on average of 20 people coming into bond court every day, which for a city as large as Chicago, for a county as large as Cook County, is a significant reduction for our central bond court to have those few people. So I think there's a lot of grace that's being extended. Warrants are not being issued like they normally would. People are not being brought into the jail for things like that. Similar to what was said before, the majority of the people that are coming to our jail are for violent offenses, particularly domestic violence charges. So I think as a jurisdiction overall, there's been a lot of effort to reduce those types of sanctions because right now it's too dangerous to operate as we normally would.
Thank you. I'm going to move to questions about reentry since we have a lot on that. So you mentioned in Cook County a lot of the work that's being done around providing holistic services. A couple of questions that have come in around this are, what are some of the sources of beds that are being offered? How are these costs being covered? Costs such as additional housing. And then has there been any coordination with homeless services? And similarly, if anyone has thoughts on how we can sustain funding for these sort of resources, knowing that we are in an economic crisis, there was already a need to begin with, and clearly there hopefully we'll be able to continue to release people, and we want to sustain these supports. So if anyone can speak to some of those questions, I'll turn it over to you.
So I would say in Buncombe County, the county and city of Asheville are very partnering closely to fund some of these services like the homeless shelter, the isolation and quarantine facilities. In the time that we probably talk about sustainability, I think that's going to be really some tough questions as we go into budget planning for FY 2021 and may look at reductions in revenue because of the closure of businesses. I think those are going to have to be some tough questions, and possibly partnering with our local foundations and working with our community partners that have grants and can work towards those sustainability efforts. We are also partnering with, like Eric said, the hotels, our civic center, just to make sure that people are housed during this time of COVID-19. As far as structure and communication, I mentioned our Emergency Operation Command. We have some strategic functions within that, including behavioral health work groups that are meeting regularly, homelessness work groups that are meeting regularly, and these homeless services are working and meeting every 2 to 3 days. And that includes the partnerships with the jail and other conjugate living facilities. So there is a lot of structure happening to ensure that we address COVID-19, from long-term care facilities to our jails to those who are unhoused and unsheltered.
Thank you. Does anyone else want to jump in?
Yeah, so similar to that, we have always had contracts with residential providers for individuals who we deem to have no place to stay coming out of our jail. So we always have beds in the community. We've always had beds in the community that we have set aside for individuals coming out of the jail. We've had to expand those resources in light of the COVID-19. And I think from a funding perspective, the county and the city both have just prioritized that because of the seriousness of the COVID-19 issues. We've reached out to community partners who are already receiving grant funds from the county to see what the capacity they have to help provide services. We've worked with various homeless advocates around addressing the homelessness population in general, which has, there's so many people, regardless of whether they're in the jail population or not, that are homeless, that have this great need right now around housing and food. And so we've tried to coordinate with that to make sure that there are beds that are reserved for the jail population, so that we're not having to directly compete with the larger homeless population, because the need is so great for the homeless population in general. I don't think that anyone's really concerned is not the right word, but our priority right now is making sure that everyone, as many people as possible, have a safe place to go and have access to the resources that they need. We will let the chips fall where they may and figure out the long-term budgeting impact that will have on the county. And I believe that the city's taken a very similar approach, but both government entities have just prioritized doing whatever we need to do right now to keep everyone safe. And we will deal with the fallout from a budgetary standpoint when we get through this.
Wonderful. I see that we're reaching time. There were some other great questions about policing and some concerns there, as well as the suggestion to partner with restorative justice agencies and programs to do conflict resolution. I think I will turn it back over to our host since we don't have much time to address that, although we would love to see that happening. And we hope that it is. So Nancy, would you, or I'm sorry, Liz or Nancy, I think Nancy was just doing introductions. If you'd like to conclude us and see if there are any last words.
Yeah. No, I think that was great to hear from everyone. Thank you for sticking with us through the technical difficulties. I hope this conversation will continue and that we can all continue to learn from each other, both on the government and community side. So thank you, everyone. Be safe and be well, and look forward to keeping in touch.
Thank you.
Thank you.